Welcome to Public Health Matters, the show that addresses public health issues that matter the most to the citizens of Harford County. Real issues, real people, and the information you need to know.
Hello, I'm Rania Nassar, Public Information Officer for the Harford County Health Department, and your host for today's Public Health Matters, the show that takes a closer look at the public health issues that matter the most to the citizens of Harford County. Today's topic for Public Health Matters is respiratory illnesses. We will be discussing this topic in order to raise awareness of what respiratory illnesses are and how we can work to prevent them. Joining us today is Dr. Lisa Thomas, Director of Emergency Department Clinical Operations at University of Maryland Upper Chesapeake Medical Center, and Dr. Jason Birnbaum, Medical Director of the Intensive Care Unit, Upper Chesapeake Health, and Medical Director, Upper Chesapeake Medical Services. Welcome to our show, and thank you so much for being with us today. So let's dive right in. If you guys don't mind, just taking a moment to just introduce yourself and what your connection is to the topic of respiratory illness. Like to go first? Yeah.
Sure. Thanks for having us on the show, Rania. It's a pleasure to be here.
Yeah.
My name is Dr. Lisa Thomas. I am a practicing emergency physician at the University of Maryland Upper Chesapeake Health. And I see patients of all ages who may present with any type of emergency at any time, including respiratory illnesses. And I also oversee the day-to-day operations in the emergency department at both of the hospitals in this area, including Upper Chesapeake as well as Harford Memorial Hospital.
Great, thank you. And Dr. Birnbaum?
And I have the pleasure of working with Lisa at Upper Chesapeake Hospital, and I oversee the intensive care unit as the medical director. I also oversee the employed practice arm of Upper Chesapeake Medical Services and happen to have a outpatient pulmonary practice.
Okay, great, wow. Thank you both so much. I'm sure this is just such a busy time for both of you, so I appreciate you guys taking time out of your day.
Sure.
So what are some examples of respiratory illnesses and why are they important for us to discuss today?
So some of the common ones that we're seeing now are COVID, RSV, flu, some of the ones that cause just the common cold virus. You may hear of other ones like adenovirus, parainfluenza virus. There's actually hundreds of viruses that cause the common cold. And right now we're actually seeing an explosion of visits to our emergency department and I think many outpatient practices with the surge of these viruses. So it's very timely that we're having a segment on this to kind of talk about it as we're seeing these numbers rise kind of at an earlier time than the usual surge we see later on in the winter.
I think the other thing that's important to point out is that this is a standard seasonal phenomenon. We have changes from year to year in terms of which viruses tend to be more problematic. Sometimes seasons of a given year may be more problematic than others in terms of which virus is causing the most difficulty in terms of hospitalizations and illness. I think coming off of hopefully coming off of the COVID pandemic, there's been a lot of attention to that virus, understanding that COVID itself was typically was a standard coronavirus, which are things that we see as one of the viruses that Lisa mentioned. But now we're starting to see more attention paid to some of the other viruses, such as RSV, which we're seeing now become more prevalent as the social distancing and some of the measures that were underway for COVID are no longer as intense.
That makes some sense. So according to the Maryland Department of Health, there are certain respiratory illnesses that have been on the rise this fall, such as RSV, flu, and COVID. So is there a connection? Has COVID-19 affected respiratory illnesses?
Yeah, that's a good question. I think Jason just alluded to it. So with the social distancing and the masking and all the preventative measures we were taking the last couple years during the height of the pandemic, this actually prevented transmission of all respiratory viruses in general. And so there were some people that did not get sort of their yearly dose of exposures to these things, especially children who were kind of kept inside and not encountering these viruses. So now, as these preventative measures have been relaxed, we're noticing that some people are encountering some of these respiratory viruses for the first time in their life, and they don't have any immunity towards it. So we're seeing that more of these patients are getting sick. And even in adults who normally would get viruses from year to year, their immunity has waned, and so some of the older adults are also getting sick with these viruses. So it's just a lot of the viruses coming together at one time.
Okay, that's interesting. So what is RSV, and what population does that affect, really?
So RSV stands for respiratory syncytial virus, and it's a virus that historically was known to be a major problem for children, particularly young children. It caused a phenomenon called bronchiolitis, which is a term used to describe when you get inflammation of the smallest of the breathing passages that lead out into the lungs and the air sacs. And kids typically would get it, and it would involve the lower respiratory tract, such as in the lungs, the trachea, the bronchial tubes. Adults have been getting it all along as well, and it was typically an upper respiratory infection. So you'd have the typical sinus symptoms. You may have a dry cough, some sinus congestion. Fever can occur as well. But the interesting thing is, with the advancement of technology and our ability now to diagnose these viruses quicker, we're able to see which patient populations are affected. And in particular, we're seeing adults who present with either an asthma attack that seems to be prolonged, or a patient with chronic lung disease such as COPD or emphysema that has a particularly bad attack. When they end up sick and we test them, we're finding that some of the patients are actually sick because they have underlying viral infections that's exacerbating their underlying medical condition. So we're recognizing it more in adults, but clearly the bigger population has always been children.
So I know you touched a little bit on the symptoms of RSV just now, but what do new parents and other family members need to be looking out for RSV?
Sure, I can take that one. Yeah. So it presents with usually typical cold symptoms. You may have a cough, a runny nose, congestion, sneezing, fever. Those are some of the typical symptoms that it may start with, but then it can also go lower into the respiratory tract and kind of seed into your lungs, what Jason alluded to. And then those children may then develop wheezing noises where there's high-pitched noises coming from their lungs. They may have harder time breathing. They may look like they're moving their chest more. Those are some signs that the child is having more difficulty in their lung as a result of the infection. And then in younger children, there may be some atypical signs because the younger children don't necessarily mount the same responses as some of the older ones. So they may present early on with just poor feeding, poor appetite, irritability, crying excessively, those kind of symptoms. And one of the things that parents need to look out for is if they notice that a young child is getting sick, they also have to look out for something that doctors we call apnea, meaning a pause in breathing. And that's a complication that we can see with RSV. And so the reason that this is getting to be a big deal, and you're hearing more about this, is that as these young kids might have some of these breathing issues as a complication of RSV, they may need medical attention beyond just what could be provided at home. If they need to be brought into the hospital to get assistance with their breathing. Some may need oxygen or special breathing machines that might help support them when they have their illness.
And you'll always see symptoms, right? It's not like they won't have any symptoms and then diagnosed with RSV. Like they'll have one or more than one symptom, correct?
Yeah, I think it's important to understand that RSV is one particular virus amongst many, as Lisa had pointed out earlier, and that there's a lot of overlap. And understand that even before the pandemic, people got colds. And in fact, it would be unusual not to go through a season or a year without a cold. And I think you have to approach it that way, that if you have standard symptoms of upper respiratory tract type symptoms, which are the runny nose, you can be a little achy. But the difference is when it goes into the lower respiratory tract, the greater majority of people, whether it's kids or adults, it remains an upper respiratory tract infection, and these people get over it, 7 to 10 days. It's the patient population where it becomes more complicated than a simple upper respiratory tract infection, And those are the ones that you need to be a little bit more careful of. And again, Lisa mentioned some of the issues with the younger children or the infants, which are a little more atypical in their presentation. And those are things that a new mom or a parent would be aware of if they noticed their child was not acting like they normally would. But again, in adults, I want to emphasize the majority of these folks end up with just simple URI symptoms that they get over in 7 to 10 days.
And just to piggyback on that, Jason, even in kids, the majority of kids will clear this on their own without needing any kind of assistance medically at all. I think the rates of hospitalization in young kids is about 2%. The only reason that we're hearing more about it now is that there are a larger number of children getting RSV now for the first time because they haven't been exposed to it in the last 2 years. And so then that 1 to 2% that are getting sicker, that number is just overwhelming the system, and we're seeing more ICU admissions and things like that. But again, the majority of kids will clear this infection on their own.
Adults too.
Yes.
This is a really good segue into my next question. So is there any way to tell the difference between RSV, flu, and COVID? And are any of these symptoms unique to a specific virus? Which I think that could be a tricky question.
So one of the things I can say, having a practice where I see patients in the outpatient setting for pulmonary as well as seeing sicker patients in the intensive care unit, is there's a spectrum of illness that you can get with all of these viruses. And what we tend to see in the hospital, the ones that get to that point that are hospitalized tend to be the sicker percentage of patients with any of these viruses, including RSV, COVID for that matter. The patients that don't end up in the hospital tend to be the ones that are self-limited and they're fine at home. The challenge is that for most patients that don't present to the hospital, you're basically presenting with very similar symptoms. And in fact, that's why we refer to it as a cold virus, because it's made up of multiple different viruses. When patients end up presenting to either an urgent care or a hospital, at times when we think it's going to change how we manage them, we now have the ability to test for viruses in nasal secretions. And everyone now is familiar with it because of all the COVID testing that's gone on. But with COVID, the technology has advanced such that the majority of patients who show up either at urgent care or in the emergency department will be screened for those viruses. And now, in addition to COVID, it's common to get COVID, influenza, and now RSV on the screening test.
When we do that one nasal swab that goes in the nose, we typically can get the results of all three at once.
And I think it's important for really two reasons. One is it helps us understand and appreciate why certain patients that have had controllable issues such as asthma or COPD are having problems. And the other thing is, with the rampant use of antibiotics and trying to minimize the use of antibiotics so we don't develop resistance, it allows a clinician to treat someone with what we call supportive care rather than giving antibiotics off the bat, which is generally what we would do when patients end up in the hospital with respiratory complaints. The old adage that it's probably viral, well, now we could actually say that with more confidence.
That's great that it's one test or one swab for all three. I'm sure like people love to hear that instead of doing 3 nasal swabs.
Yeah, and in fact, that's the screening test. And there's additional testing that when we have a sicker patient in the hospital, we can run a test where it's a similar process, but it gives us a variety of almost 20 different viruses to choose to pick up.
And so beyond the ones we've mentioned, we're actually seeing a whole host of them, including rhinovirus, enterovirus, and even some scary sounding words that people have never heard of, but have been infecting people with common colds for decades. So like human metapneumovirus. Sounds very scary, but it's been around for ages.
Yeah, that's great. Are there any specific risk factors for respiratory illnesses?
Well, I would say, I mean, again, looking at my patient population, it's very similar in terms of risk factors to other conditions. Age, either the very young or the very old, and then what we refer to as comorbid conditions. So basically patients that have other medical problems, complicated medical problems, that may indirectly affect their response to viruses. So diabetics, patients with heart conditions, and then something that I see a lot of, which is underlying lung disease.
And then a couple other things are people with weakened immune systems, transplant patients, people with cancer, and then in the very, very young children, if they were born premature or have congenital heart conditions, things like that. And of course, Jason, I'm surprised you didn't mention this. How about smoking?
Oh yeah. Essentially, you know, when it comes to smoking, there are those who smoke that have underlying lung disease that they don't recognize. And then just the irritation and the inflammation caused by cigarette smoke within the airway can lead to an environment that makes someone more susceptible to getting illness, but also more severe illness.
How are respiratory illnesses transmitted?
So that's a great question, and I'm sure that's probably something you all know about, but these viruses are transmitted by droplets that we put into the air by coughing and sneezing, and then a person may inhale those droplets, and then it gets into their oral, nasal passages and can get into their lungs. These droplets can also sit on contaminated surfaces, and then one may touch those surfaces and then touch their eyes or mouth and then transmit the virus that way as well.
I think, and again, piggybacking on what Lisa's saying, I think the biggest issue is hand washing. In terms of, these are droplets, these are secretions that are left on tabletops, doorknobs, things of that nature. And while we don't want to get overly obsessed with this, I think getting into a regular pattern of, if you go into a store, when you leave the store, use your hand sanitizer. But that is going to be the best way to combat this. Because remember, there's a distinction between respiratory droplet and things that end up on surfaces versus something that's airborne or aerosolized. So most of these things we're referring to are droplet.
So I know we did touch on this a little bit about the treatment for RSV and other respiratory illnesses. Is there anything else that you would like to add for the treatment of this, maybe at-home things that people can do?
Yeah, so that's a really good topic to bring up as well, because in general, these are viruses, and there is no specific cure for these, any of these illnesses. So, you know, the best thing we can do is to try to prevent them by getting vaccinated, and to try to prevent the spread. Now, in some patient populations, there are some antiviral medications that are available. So if you have certain risk factors, there are some medicines that you may want to speak to your doctor about for the flu and for COVID.
I think the other thing to be mindful of is that viral infections or respiratory tract viral infections have a typical course that they run. And generally speaking, we all know what it feels like when you're starting to get a cold. Your throat gets kind of sore and feel kind of achy, and then you go into the congested phase, and that tends to linger for a few days. But generally speaking, by about 10 days, symptoms are completely gone. Patients who, as they're going through that period of time, are starting to notice that not only their symptoms persistent, but maybe getting worse, are those to be considering getting attention. The other population that I would be mindful of is patients with underlying disease. So the population I mentioned before, and in particular, the patients that I take care of with chronic lung disease, patients on oxygen, those are patients who perhaps may be more aggressive in getting their physicians or their healthcare providers involved early rather than later. What I try to tell patients, generally speaking, is that patients without major medical conditions, if there's something that, if the things that you're doing can be done at home and you're improving, you don't need to seek urgent medical care. It's when you're not improving or symptoms are getting worse and you're starting to have issues with being able to manage your symptoms, or if you're an at-risk patient population.
And if I can add some practical advice for people with just kind of common cold symptoms, it is okay to take, you know, acetaminophen or ibuprofen as needed for fever. I notice sometimes people come to the emergency department and they feel very sick and they have body aches and headaches and just different things that if they just took some medicine, they could actually feel better. So I encourage people to treat the symptoms they have. You can use over-the-counter decongestants as needed, and then try to stay hydrated because we want to avoid dehydration as a complication as well.
So many emergency rooms across the country are being swarmed with respiratory illness patients. When should someone go to the emergency room when it comes to respiratory illnesses? And what symptoms require that ER visit versus just the urgent care visit?
Sure, that's a great question because as you brought up, we are seeing a huge surge of visits right now. So the healthcare system is under a strain at this point, and we are experiencing longer than normal wait times in the emergency department. So I think the main point, as we've been talking about, is if you have common minor cold symptoms, you can try to call your doctor or use the urgent care, or even telehealth services are more available these days, and perhaps try to just get medical advice about how to manage at home. But of course, there are certain populations and certain symptoms that should seek medical attention in the emergency room. And with respect to the respiratory illness, it's really if one is having difficulty breathing. If you're having significant difficulties where you notice you're breathing faster than usual, you know, in little kids, you might look at the pattern of their breathing, if their muscles are being pulled in, if their rib cage is being pulled in an abnormal way. Those are signs to call 911 or bring the child to the emergency room. If there's discoloration, like a bluish tinge to the face or lips, that might be a sign of low oxygen. If someone has other complications from the illness, meaning dehydration, where there's been no urine output for 8 hours, let's say, something like that, those would be reasons to come to the emergency department as well. And one other thing, for some special populations, if you are a very, very young, for example, less than 3 months of age with a fever, that may be a medical emergency, because even if everyone else in your house might have COVID, the youngest infants don't have the full immunity to other serious bacterial infections. So it's very important that a child under 3 months should be evaluated if they are having high fevers. And also older adults who may be having other immune conditions or other medical conditions may also want to get evaluated if they're having respiratory illnesses and other symptoms.
I also think it's important to recognize you can be very proactive. So at this time of year, as we're talking about all these things and we're realizing that it's the prevalence in the community of these things are high, you should be speaking to your primary care provider. You should be speaking to your pulmonary specialist or your doctors. You should have an action plan in place to determine what you need to do and when you need to do it. Obviously, if you don't have a primary care provider, educate yourself on the signs and symptoms or the things that you need to take action on versus the things you can simply manage at home. What we're trying to be very mindful of is people getting the right care at the right place. So we're trying to leverage the primary care provider's office, the specialist's office, the urgent care, and then, as Lisa said, reserving the emergency department for the sickest of the sick, so that people that need that type of care are getting it in an expeditious fashion.
Why is it important for us to get the COVID booster? Can you get the flu vaccine and the booster at the same time now?
Sure. So just as we develop a different version of the flu vaccine every year to accommodate changes in the strains of the virus, the same thing is happening with COVID as well. And so the newest booster that's available now is called a bivalent booster, meaning it has activity to cover the original strain of COVID as well as the variants. And the immunity of all these vaccines wanes or decreases over time. So that's why it's important to get the vaccine and then get boosters to bump up that immunity again.
No, I would agree. I think recognizing the fact that COVID, similar to influenza and RSV, there's different subtypes, there's different varieties, and the viruses are always evolving. So as the viruses evolve and they're trying to survive, we have to come up with vaccines that combat those viruses. So staying up to date and keeping our immune system updated, if you will, is very, very important. I will tell you that all my colleagues regularly get vaccinated, and it's not even a question for us. And again, it's if you can avoid getting sick entirely, why not? Why would you not want to do that? And then in other instances, it may actually blunt how sick you will get by having exposure to the vaccine. So unlike what some people think, that vaccines are there to prevent you from getting an infection. Many of them are there not to prevent the infection, but prevent you from getting seriously ill from that infection.
Yeah, I think that's a really, really important point. It's not that you won't get the illness. It's that if you do get the illness, you will have a less likelihood of serious complications like hospitalization and death.
And I saw something the other day where it says, you know, look at a booster as like you're getting recharged, like you're recharging your battery. So again, I think we should continue to promote, you know, getting your booster, getting your flu shots. I think that's just really important. So I'm glad we touched on that.
And to answer your question, is there now, it's okay to get both the influenza and the COVID vaccine at the same time.
Which is good. Just get them both done and over with.
Exactly. And one other thing I wanted to add on that point is that even if you've had the illness, it's still important to get the vaccine and the booster because of the fact that there are different variants of the illness that you could still get again. So even this flu vaccine actually is a quadrivalent vaccine that covers 4 different strains of flu. So you could still have flu A and then later get flu B. So it's still important to get the vaccine even if you have the illness.
Do you see any disparities in respiratory illness cases?
Well, again, talking to those of us who work in hospital settings, you're selecting out a certain patient population. So when you talk about the community at large, it's going to be different than what we see. So for example, as I said earlier, whether it's the emergency department or in the hospital, we're going to see a selected group of patients who tend to be those that have other medical conditions, who are older or very young. The general population is all comers. So again, the majority of people, no. But going back to my original point earlier, if you have underlying medical conditions, if you have an immune issue, if you're on medicines chronically, such as prednisone, or if you're receiving chemotherapy, those are the types of patients that we tend to worry about, and those are the ones that have the potential to get sicker than someone who's just in the general population.
Great. All right. Well, I appreciate you both so much for being here. I think we covered so much, and this is really important and very timely too for now as well. So that's unfortunately all the time we have for today. I would like to thank my guests on today's show, Dr. Thomas and Dr. Birnbaum. If you would like more information on respiratory illnesses, please refer to the resources page after the show. And join us next time for another important health issue that mattered the most to the citizens of Harford County. Thank you so much for watching.
You've been watching Public Health Matters, brought to you by Harford TV. Watch what matters.